It's been known for a long time that people respond differently to medications. We are now starting to be able to identify some genes that can guide us in recommending doses. While it would be cool to have genetic mutations that would allow the patient to fly or toss cars around, genetic superpowers are usually restricted to the ability to metabolize a drug really, really quickly. Not much use in fighting off an alien invasion, but important to know when treating a disease. The FDA has included notes about genetic-based dosing in a number of package inserts. A good source for finding this information is the Pharmacogenomic Knowledge Base website. Gaucher's disease is an inherited condition in which the patient lacks an enzyme necessary to break down a particular lipid. That lipid accumulates in various organs, leading to hepatosplenomegaly, neutropenia, osteoporosis, and a variety of other symptoms. One treatment for Gaucher's disease is to give oligostat, which inhibits the formation of the toxic lipid. Oligostat is metabolized by CYP2D6. Some patients are considered CYP2D6 ultra-rapid metabolizers, while others are extensive metabolizers, intermediate metabolizers, and poor metabolizers. Metabolizer status can be determined with a blood test. Knowing metabolizer status can help determine whether a patient should get the drug once daily or twice daily. It's also possible that the patient clears the drug so quickly, it might not be effective at all. Another drug for which the FDA recommends CYP2D6 testing is Pimozide, an antipsychotic. For Pimozide, the warning is that poor CYP2D6 metabolizers will have longer half-lives, take longer to reach steady state, and will have higher serum concentrations. Other drugs for which CYP2D6 testing may be valuable include atomoxetine, used for attention deficit disorder, tetrabenazine, used for Huntington's chorea, vortioxetine, used for depression, iloperidone, aripiprazole, and brexpiprazole, which are antipsychotics, and celecoxib, an NSAID. In addition to testing for CYP2D6, testing for activity of CYP2C19 can be helpful. In high concentrations, citalopram, an antidepressant, can cause abnormal heart rhythms. If we know the result of the blood test for CYP2C19 activity, we might detect that the patient is a poor metabolizer and shouldn't receive more than 20 milligrams daily. There are similar maximum daily doses for slow metabolizers who are receiving clobazam, a benzodiazepine. Besides phase 1 reactions involving the cytochrome P450 system, there are also mutations that can affect the rate of phase 2 conjugation reactions. Belinostat and irinotecan are cancer drugs that both undergo conjugation with glucuronide moieties in the liver to make them more water-soluble. Some patients who have less active glucuronide conjugation may need to have their doses decreased to avoid toxicities. Genetic testing for UGT1A1 activity can help us identify those individuals. Warfarin labeling includes dosing adjustments both for patients with altered CYP2C9 activities and for those with the vitamin K epoxide reductase complex subunit 1 gene mutation. People with the mutant A allele produce fewer clotting factors than those with the typical G allele. Patients with the A allele should receive lower warfarin doses. While there's only a handful right now, you can expect an increase in the number of drugs that are dosed based on genetic testing.